In our checkup today, the Food and Drug Administration has approved the first over-the-counter birth control pill. And once available, this medication called O-pill will be the most effective birth control method over the counter. The pill's manufacturer says it will most likely become available from stores and online retailers in early 2024. Here to talk more about it, Dr. Jeffrey Holzbeierlein, physician-in-chief at the University of Kansas Cancer Center. Doctor, thank you for being with us. This sounds like pretty significant news for folks looking for another option. What's the headline here and any thoughts on it?
Yeah, I think it is. It's one of a long line of prescription medications that over time show very safe profiles. And so I think it does offer options to a large group of people who may not otherwise have access to that type of medication. And again, the demonstration of it being a safe and effective treatment or medication is the paramount thing here.
And it is similar to the pill that people would get as a prescription. Is there any difference to it?
There are differences. Obviously, prescriptions can be different depending on the individual. This is a progestin only, and the major concern that people have had with many of the oral contraceptives have been blood clotting risk, and particularly some people, smokers, people that are obese might have an increased risk. So a progestin only does lower the risk of blood clot. You still recommend, obviously, anytime you're starting a new medication, making sure that your physician and your care team is looped in. So whether that's an over-the-counter medication or not, always important to make sure that your physician knows that you're taking that.
Another health topic I want to get your thoughts on: the Environmental Protection Agency considering making some big changes to its lead exposure guidelines. This is for residential buildings and child care facilities. There's a new rule that would change the lead dust hazard level, meaning that any lead found in a building would be considered dangerous. The EPA says the tighter rules would limit lead exposure to up to 500,000 children younger than 6 each year. What are the major concerns when it comes to lead and a child's health?
Yeah, so we've known the initial lead policy was put in place in 1978. So it's an old policy, and we've known that exposure to lead in children really can result in significant developmental delays and some neurologic problems. And so I applaud the EPA for this effort. I think it is critical that we, of course, are protecting one of our most vulnerable populations. We clearly know that people from disadvantaged backgrounds have also, less access to newer buildings and places, and so they tend to be disproportionately affected by lead and old lead pipes. So I really do applaud the EPA for this effort. Certainly, we know there will be a cost associated with it, but something that's really critical.
Is there a step that parents and caregivers can take to reduce the exposure to lead? Some things that they should be doing on their own?
Yeah, clearly, obviously, you can drink bottled water, but those things are expensive. But if you do have a concern, you can order lead testing to be done and find out how much. If you live in an old building, you can find lead testing that can be done at your health department that might help you inform what your real risk is. And again, always visiting with your pediatrician to understand what the limits are for lead exposure. But it does a total infrastructure overhaul where we're really not putting any of our children at risk is what's needed.
Right, and aggressive measures to prevent it important here. There's also new research that found that melanoma more deadly in Black men. Some scientists analyzed more than 205,000 cases they found, while melanoma is more common in white men. Black men were 26% more likely to die from the disease because oftentimes they get skin cancer. It's in unexpected places. For instance, in their fingernails, the bottoms of people's feet. This contributes to late diagnosis and worse outcomes. Talk a little bit about advice you would have for Black men and women when it comes to early screening for skin cancer and how to get the help they need when they need it.
Yeah, so it's such a critical point to bring up, is that so often, in many of our minority populations, we sort of overlook, screenings. And we could point to just a variety of different cancers or other health conditions where we're really not doing the job that we should do. Melanoma is a particularly challenging one because it disproportionately affects whites more. But like many other diseases, we're seeing worse outcomes in African-American patients. And
thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.